one of our last talks for today is sort of switching gears for a moment. We've talked about the experience of the patient at many different levels, which is one of the big things that the KCA looks to support. But there's a whole other community out there that we support as well, which is the caregivers. And there's a whole different side of things that they look at that they need not only support in, but advice on how to give that support to their loved ones and friends and family that are suffering from kidney cancer. And we have Sarah Rosner, I believe is how you pronounce the last name there, who's with us today, who's going to be sort of walking us through some of the stuff from the caregiver side with her panel. So Sarah, I'm going to turn this over to you.
Thank you so much, Sally. And thank you all for coming and, getting more information, because honestly, that is something that I wish I would have had, this kind of community. And it's so beautiful. And now it's part of my mission to work on preventative care and also be able to help caregivers, because it's something often missed. So I would love to get to it and introduce some of our panel. We have Milton and Kathleen with us today. So we're going to start with the name and the state of your loved one, the relationship to the patient, your patient's diagnosis, and yeah, let's begin. Let's start with Milton.
Hi, good afternoon. My name is Milton Wade, and I'm a caregiver to my son, Micah Wade. We're currently, actually, it's an ongoing situation. I'm actually speaking to you from the family room at NYU Langone Hospital. He's been here since September 1st. So he's had an episode of something that we didn't expect. He is currently dealing with renal medullary carcinoma. It was discovered at stage 4. Where that's normally when it's discovered. So he's currently getting chemotherapy. Actually, unfortunately, because of what's been going on with him, it is now the end of the 5th week when he hasn't had it. He should be on a 3-week cycle. So, but currently, he's unable to eat, and he had a paracentesis to clear fluid in his abdomen, and it progressed to something where he's in pain, and we ended up going to the ER, and he's been here since. So we are currently dealing with his inability to eat, and for the past week. So he's on fluids, IV, and it's been pretty tough. A lot of things going on, approaches from different areas. So he had another procedure yesterday, so we're hoping for a turnaround to clear his intestines so that we could begin a process to getting him back to eating, and then we'll take it from there. The challenges that we have is that trying to get him from where we are to the hospital where his current oncologist work. And we're dealing with, I guess it's because of COVID, where it's hard to get a bed to transfer him. And at the same time, the hospital staff has been great as far as the nurses. They're the professional caregivers, I would call them. And I guess also because of the current state of the pandemic, they're overworked and doing the best they can. I really appreciate them, but apologize because people will come in and out of this room, but this is the most quietest place I could find in the hospital.
I'm so grateful for you to still come and hop on and share your story and share what's going on with your son, because I'm sure that's very challenging, especially because you're dealing with it right now. Has there been any piece of advice that you've received while caring for your son that has really helped you?
Um, the advice, there was a earlier webinar I listened to probably about three weeks ago about advocating, and it really advocating for as a caregiver and being an advocate. And throughout the time that my son has been diagnosed, I have learned to use the resources at the hospital, especially uh, patient a patient liaison. Whenever I wasn't getting an answer or I felt frustrated, and because sometimes there's miscommunication. It's been experienced that in a hospital setting, there could be miscommunication between with the physicians
Mhm.
and the nurses and the family.
Yes.
And so I've learned to try to close the loop as much as possible. And if it meant pressuring the medical team to keep me up to date or even keeping the nurses up to date. Um, and I guess it's basically to speak up. A primary example was my son was NPO, so he wasn't supposed to get any fluids, and um, they didn't do the procedure, but they forgot to put him back on the IV. And I said, wait a minute, it's been half a day and you didn't do anything. And turns out the physician forgot to communicate it. Just went on to take care of other issues, and it wasn't intentional, but my son was forgotten about, and I had to speak up. So that's something to be very vigilant about your family members' care, and not to be afraid to speak up. Everyone we're all human, but at the same time, I've learned to be selfish, where I have to prioritize my son's care above anything else. And um, because I've done that, I've gotten better responses from the staff in general, and it's brought about them being more attentive as
Mhm.
opposed to just going through the motions. Not that they all do, but when you're overwhelmed, as I've noticed that um, the nursing staff, they are overworked, and I guess it's nationwide. So it's a new paradigm that we all are experiencing. So I have to take note of that, but at the same time, I have to put my son in my thoughts and make him a priority over anything else.
You're doing an amazing job, and I hope that, your support system is telling you that. And once again, thank you, because I know this is very hard to share.
Thank you. You're
Of
welcome.
course. And Kathleen, if you could share a little bit about, your story.
Sure. So, Milton, thank you for sharing that, because it actually leads to something I'd like to share as well, if I may. So, I am the surviving spouse of a renal cell carcinoma patient, RCC. You'll hear he was diagnosed through a routine visit with his urologist for a non-associated issue, and we found tumor on his one kidney. He had had a kidney removed when he was younger, non-related, non-cancer related, genetic issue, and he passed away last May. So I am the surviving spouse. I was the caregiver. I heard in the group before us, Deb was excellent. And someone in that group, I believe it was, and Deb reiterated, and that is, we lived our lives with purpose. And he lived his life with purpose from the day he was diagnosed until the day that he was no longer with us. And by that, he spent 3 days in a coma prior to passing away. But I'd like to, if I may, Sarah, build on what Milton said about caregiving and advocacy and the doctors and the nurses. So to try to circle that all around. One thing that I like to share with anyone I know who has cancer or any other disease that requires longer term treatment is someone has to be the eyes, the ears, and the mouth of the patient. That's really, in my opinion, what a caregiver and an advocate are. So we care for the patient and do what we can for the patient. In my case, it was my husband. So if my husband needed me for something, I was the shoulder to cry on. I was the person to yell at. And in the end, was the person who was taking care of him physically. But a lot of what that entailed in general is the same as Milton is talking about. And I know that we regularly now talk about COVID, Milton. If I could speak to you directly a little bit here, we talk about COVID being the problem, and the problem isn't really just COVID. I think it exacerbated it. But in terms of a team of doctors and nurses in a hospital setting, is they're all so quickly touching each patient or each patient chart that they're moving from one to the next, to the next, to the next. And they forget that it's a human being that they're treating. And they forget that then there are human beings attached to them. And that one of the best things they really can do for us as family members, caregivers, and patients is to give us information and keep us looped in. When my husband was in the hospital, the worst thing you could do was go and visit him. He hated it. He did not want you in his room. He would have been very upset if I were sitting where you are, Milton. I mean, those were some of the biggest arguments, just who he was as a patient. But trying to glean information from him about his own care was difficult at best, as I'm sure you're finding, because a patient can only take in so much information, right? I mean, they can only take in what they can take in. They can say, I'm hungry, I'm in pain, leave me alone. When am I going to get out of here? I have to go to the bathroom, whatever it is. But they're just waiting to hear what the next thing is. So they don't always pay attention to the details of the bigger picture. And as a caregiver and advocate, because I think those go hand in hand, especially for family caregivers who are as close as Milton and I are, a dad and a spouse, we're in it on the daily. And we really do need to know, because there are lies we tell ourselves as patients and in good and bad ways, right? Like my husband missed the fact that the survival rate was very low past 5 years. Now, I'm not saying someone can't live past 5 years, but in his mind, because there was someone 24 years, when he got as sick as he did 3.5-ish years in, it was mind-blowing to him because he didn't have that information. But as the caregiver, being able to discuss that and remind him back in my notes, hey, Dr. So-and-so, remember they told us when they were telling you this thing that, their goal is to get you past that, but the reality is that many don't. But I've gone on and on. But I just want to congratulate you, Milton, for standing up. Sometimes we need to be harsh with the medical professionals about information and care. That's our job as caregivers, in my opinion.
100%. And I'm curious, Kathleen, what has been one of the best things you did while caregiving to advocate for your husband?
So for me, it was the note taker. It was asking the hard questions. It was being a resource for both my husband and the medical professionals. And to be honest, I wrote this down and I put, it's okay to be harsh with others when necessary. And that includes people who are trying to help you. The biggest thing I found, the hardest thing to do, was stand up and say, at the beginning it was hard, was stand up and say, stop giving, we don't care about your treatment, your friend's treatment, what you think should be happening. We have a good group of doctors, we have people we're talking to, we have research, we have the KCA, etc., for the information we need. And you need to stop treating my husband like the disease and treat him like everything is as normal as you can, knowing that he just has this disease.
That's beautiful, and that's so important. And I'll share a little bit about my connection with kidney cancer, but I really felt that there always needs to be someone in the family that is that note taker, because that way you can really provide for them or be an advocate and a caregiver at a different level. It's really difficult, but it's so important. My father, he passed away from stage 4 kidney cancer at the age of 60. And I'm, I guess, a little further ahead. It's been 5 years now. And like I said before, I wish I would have had some sort of outside support group like KCA is doing for everyone here. And he unfortunately passed away within 2 months. But I did my best as an advocate to really research all of the options out there, because that was important, and to note take, but also I needed to learn how to understand what my father really wanted. For my dad's health, my mom and I decided that she was going to stay by his side and reach out to his coworkers and friends while I took care of contacting his family that unfortunately he wasn't that close to in the end of his life, but also keeping his spirits up. And although that was very helpful to him, it was also very challenging for me, because I needed to stay that uplifted light the entire time. So there's so many challenges from all 3 different sides and perspectives that we've shared. I would also like to tap more into this 2-pronged question. The KCA is a big proponent of encouraging caregiving communities and not one singular caregiver to support the patient. The patient is the center of one circle of community, but the caregivers need to be the center of another community, both inner circles needing their own network of support. First, how have you best utilized your own community to support you? And second, how did you use different people in your patient's community to support them in addition to you? And whoever would like to start can just jump right in.
Well, this still is ongoing for me, but early on, I looked up. I had to know what RMC was, and I was able to find the Chris CJ Foundation for RMC, and also RMC support. I just filled out a survey, and but once I was in touch with Richie Johnson, she is, of course, she's well known, and she's been my main support source. Although we are thousands of miles away, she's given me in telling her story, I was able to relate to what my son is going through. And there is actually someone here in where I live in Jersey who whose husband passed away from it. So I have that. But within my family self, immediate family, it's been tough. I haven't established a consistent support. The only thing I would get is an occasional social media, the prayer emoji, and or acts how they're doing. But it just seemed that at the beginning people were interested, but then it kind of faded. They meant well, and they still do, but I have to be the most consistent one. My son's mother, she's had a tough time processing the whole thing, as well as his sister. They don't live; we live separately. So he lives with me. So I have to do everything from. It's tough. So I haven't really found the support. I've had to support myself in a way, and him as best I can. I try to keep everyone up to date. So I guess in a way I become the public relations man.
You're doing great.
But it's a challenge, and it's an ongoing challenge. And the only thing I do have is just that one consistent support from the CJ Foundation, which is dedicated to this specific disease, and also just being involved with this symposium, it does become my network of support. But this is all I have, and this is all I have to go by. But for the most part, I just try to remain positive and do what I can. It's very taxing. I'm tired. It's difficult because I go home. I spend about 12 hours on average daily. Go home, have enough time to sleep and come back to beat the traffic because he's getting care in New York City. So it's the question you ask is it's pretty tough. I only have external support and just a phone call away. I would say getting the right support and having someone who understands what I'm going through. I guess the best support is something that Richard Johnson had said. No one really understands unless they have gone through it.
That's right.
Everyone else is always, well, he could beat this. Oh, he has this. Oh, get well. He'll be okay. And without even understanding statistics. And I don't get mad. I just get quiet. There's so many things I can say that I could express, but I want to keep, I don't want to hurt anyone's feelings. The frustration part I keep within and just keep it moving because I have to be more focused on my son rather than anyone else's opinion, which sometimes could be very distractful and depressing without them actually meaning it. So I try to keep within the bubble of those who have or are currently dealing with what I'm dealing with. And that's the only way I could survive.
Yeah. You got to remember that even though this is a daily process, it's okay also to let your frustration out. You're doing an amazing job and people should also hear you. And I'm so grateful that you're sharing and not afraid to share that frustration with all of us. Thank you so much.
You're welcome.
Support. Kathleen.
So for me, I was and we were lucky enough to be surrounded by medical professionals in our lives. So my brother-in-law is a gastroenterologist. My best friend works for the Surgeon General. We have a lot of friends I personally have a lot of friends in the health and wellness. So we, for my husband, we had my best friend who works for the in the Surgeon General's office, and and my brother-in-law, who is the gastroenterologist. And so because they, at a minimum, understood the disease, that was good for us because unlike Milton, my husband, or unlike Milton's son, my husband had no symptoms, I'm going to call them, or issues until December of 2019. And again, he passed in May of 2020. So we weren't up against being in the hospital and all of that. He also never had to have radiation. So he didn't come home, as some with chemo and radiation where he was feeling ill. He was getting immunotherapy. He wouldn't feel good for a day or two, like just tired, like you would from a long day of anything, and recover. So he worked we owned a business. He was still working 6 and 7 days a week. Our son played hockey. So we needed the support on is this right? Can you guide us here? Can you help us here? How can you? So that support system for him was in place in those two individuals. For me, I have an aunt and a cousin who both, a mother and daughter, both died when they were 46 of cancer, not kidney cancer, but cancer. So my mom had already experienced walking through close family members who had had cancer. So when I would need to cry, I could call her and just vent and knew that she understood. For me personally, most of the support I got came from the running community. I run, I do half marathons, I do 5Ks, etc. And I had surrounded myself. My best friend, that's how I met her, was through running. And then there's another woman who I now would put in that group of best friends, who internationally does health and wellness, and works with the troops at Fort Meade. But she helped me along. She had lost someone, not to cancer, but through something else. So when it came to sitting in the hospital or my fears of that, we could discuss that. She lost a husband when they were very young. We were very young, she's my age as well. So I had that. And then just in general for both of us, again, outside of the cancer community and outside of the cancer, we lived on purpose, and we have 4 adult children. And then 5 grandchildren. So we surrounded ourselves with purposing to do things with them. And that helped because we weren't living in the cancer.
Thank you for sharing.
Mm-hmm.
For my community, my dad's community, and my mom, they were all very different. So my father had an amazing support system with his coworkers. They actually, once they found out, they would do rounds. They would come at least twice a week, split shifts, so that they could tell jokes and laugh and share stories. And that really kept my dad's spirit up. When we found out that the situation metastasized within a month to his brain, and it just wasn't looking great. So we all kind of knew what the situation was, but we still kept, pushing and trying to find other ways of research. And they were very helpful with that too. But again, everyone has a voice, and it can be overwhelming to hear people's opinions. Well, maybe he should be doing this. Maybe he should be doing that. But what it came down to is my dad just wanted to stay at that hospital And even though there were other options, possibly, as it metastasized, that became our only option. So even though that was hard to hear, we decided to support him that way. And I was very grateful because I had, I shared that my father's family was a little more difficult. So I was lucky to have my chosen family of friends, and they came especially, they would check in on me, but especially when he passed away. For the funeral, we had people that helped clean our house for Shiva, which is a mourning period, 7 days following a Jewish burial. They sent meals after the funeral, sent some flowers to give us a little cheer, the caregivers. But for my mom, it was very difficult for her because a lot of her friends just said no. So I was the person that was her caregiver as well. And she just felt defeated because no one was around her saying, I'll help out, I'll do this. What do you need? It was only me, and I lived 2 hours apart at the time. And I made sure to get home and spend time with her after my father passed away. But I know it can be challenging on all levels. So remember, guys, that even if it looks dire, just finding even that one person can really, really make a difference. And I've been grateful to hear all these different ways people have been connecting and communicating.
Sarah, you mentioned about people who didn't want to participate. And I think that that happens to people who are close to people. So, and I'll give you an example. And I think it's a denial. I think it's truly a denial and a fear. It's my family is a blended family, so that my husband was, I'm never sure what tense to use anymore, almost 10 years my senior, and had been married before and had two adult children who are currently now in their 40s and have spouses and children of their own. I have a child who's in her 30s, not my husband's child. And then we had a child who is now 21. My 21-year-old and my nephew, when my husband got very sick, he did not want to be in the hospital. I mean, that was something he told me from the beginning. I do not want to die in the hospital. I want to die at home. His don't resuscitate orders, all of that were all in place because we talked about end of life before it got bad. And my son and my nephew, who's about 7 months older, he's 22, were I'm going to call them the physical caregivers. They would pick him up and help him move from a chair to his bed and take care of some shower issues. And that my husband just didn't want me being the one. He, male to male was how he wanted. A daughter who lived far away, which was his daughter. She lived at the time a little over an hour away. 4 children, very busy, homeschooler, etc. A son who lived with him 45 minutes, who didn't bother at all, really didn't call to check in, didn't any of that. And then my daughter, who was there on the daily and made sure that there was food in the house and made sure that if mom needed a break, there was something going on. And it was the same even with his siblings, the ones who wanted to come, the ones who didn't want to come, etc. You just never know. And I think some of it is really fear and denial. I think my stepson, until the day that we sat them all down 2 weeks before my husband died, until my husband looked at me with sad eyes, with just like, please tell him, after he'd already said it. And I had to say to him, you cannot take your father up to the park. He can't do that. He can't get out of that chair without help. He can't. You can come and sit with him, but he's not getting up to walk to the park. That's not going to happen. You can put him in a wheelchair and he'll be worn out by the time you put him in the wheelchair, let alone get him up to the park. And still was in denial until the day I called and said, your dad has passed. And you need to, if you want to see him for the last time, come now. And he even tried to put that off. So, yeah.
There's definitely fear with a lot of my mom's close friends. They basically were feared that it was contagious. I'm not even kidding you. It's contagious that their significant other would pass or get kidney cancer, and they just didn't want to deal with it.
Yep. Yeah, exactly. Are you finding that, Milton?
No, well, for me, is because his Micah's cancer is so rare. The only thing that was disappointing which he took pretty hard, his prom date, which was his girlfriend. She broke up with him during this summer. They still remain friends, but that was traumatic for him, and I was unaware of it till he told me afterwards. First, it was a sister who told me, then he told me that, but they're friends now. But for the most part, what upsets me is that I've given friends and family members information about his cancer, and then I get repeated question, well, what does he have again? And it infuriates me where I give information and resources so they can look it up. And that's the frustrating part of it. It's not as if they know it's rare, or most of his friends, they're he's 20, so his friends, as anyone that age, they have that invincibility. Mm-hmm. But at the same time, for us, it's spreading knowledge, not that it'll affect everyone, but just making people aware of it. And that's the fight we have. But it's not, but the distancing part, the separation part, I get that. Some are in denial, and some just don't want to deal with it. So I don't hear from that. It's just amazing how, like most things, it's like a bell curve. At the beginning, not many will know. At one point, they all give their support or ask or offer it, but then when you go with the other end of the slope, it kind of it tails off. So I don't know what the reason are. I just assume that everyone is living their lives, and at the same time, I guess psychologically, it's it's someone's mortality that's on display, and they process it differently or don't want to acknowledge it at times. And for me, at least for us, it's like we know the statistics, but I really haven't given into it. I come from a sports background, education in sports, where I coached for so many years, and I've instilled in my son, because he was always a small size, just a strong intestinal fortitude to fight through things and remain tough. And now I'm seeing that's on full display rather than a sports arena. It's on the arena of life. And our journey together right now is we're closer because I'm his best friend and he's mine. And he seems to want to take care of me, although he's ill, worried about whether I eat, get enough sleep, and so on. And I appreciate that. But the exterior or external people that surrounds us, I don't worry about them anymore or feel insulted that they don't respond. We just move forward and forge ahead. And I keep them up to date on social media if those are interested. But yeah, it's like I'm just so involved in trying to to get him the best care possible and hope for the best outcome. Not that I'm oblivious to the numbers, but at the same time, I still have some level of optimism.
Absolutely.
Just with whether it's a new clinical trial or just caring for him and just finding out what I can. I learn something new every day. Whenever he gets his, I look on his my chart and see his news, whatever they put down. I look it up, and that kind of keeps me on a level playing field, because then I look up and see what is the cause of this and so on, and that in itself allows me to then respond to his physician on an intellectual basis as far as what could possibly be done, and that's just about it. But the support, at times a little disappointing. Like I'm the only one who hugs him, and he hugs me when he can. It's difficult now for him to do that, but that's something I always had in my life, hugging and kissing my son, and that in return, and not even to get any social contact. At times it bothers me, because my whole life has shifted to a new level where it's just a focus on him only, and it's like there isn't any human physical interaction from anyone else or any relatives and that bothers me at times. But for the most part, seeing him well is all I live for. And so that's been my main focus, and not worry about at the stage what other people are not doing for me. And it's kind of always been I've been the one who's cared for people, looked out for them, and never expected anything in return. So I'm still on that track to say maybe I'm too proud, but it's like, for me, is I'm not going to ask you to help me. If you offer it, I'm not going to refuse it, but I'm not going to ask.
Milton, like what you said, that your son and you are best friends, which is, amazing. You're going to have that for the rest of your life. What do you feel? Because you said he wants you to, take care of yourself and be an advocate for yourself. What do you feel has been great solution when you're outside of the hospital to make time for yourself? It's hard.
No, well, I'll tell you. I'll say about like 5 years ago or so, I just walked into a nail salon and had a pedicure and a manicure, and it felt so good. Just having my feet rubbed and so on. So like, it's like, I think for me, just getting a chance right now, catching a break so I could just go visit them and just get that done, just to be off my feet and have someone like take care of me, even if it's just for that simple thing, is like, for me, that would be like Christmas. Other than that, it's now scheduling the time, because I was into he and I used to go to the gym a lot, and he wants me to go back, but just trying to schedule the time, like what's going on now, is near impossible to do. And but it's something that I need to do, even moving forward, because I have to be stronger in case I have to lift him and so on. I knew that was in my head, but because now this happened unexpectedly, there's now a sense of urgency for me to find the time to do that. And it's a challenge, because currently I haven't been able to go to the gym consistently since May, and now it's even worse, because I try to spend as much time, because the timing of when the nurses make shifts and make sure that he's taken care of, and I sometimes when I'm not here is when something happens. And then I have to say, okay, so now I'm up at 5 a.m. Commute from New Jersey to New York. So I'm here at 8 o'clock and actually 7:30, and then I don't leave uh, till 9 p.m. and then drive back home. And then I'm just so exhausted. So that's why I said just even trying to get a pedicure and a manicure, that has to be my only reward for the time being. And then hopefully we could get through this episode and I could go back to budgeting my time better. But time management is a very important, but for me currently is a challenge. But I am aware that it's necessary.
Yeah, it's really challenging to make time. For me, I literally just took walks around the hospital to get fresh air, cry, and just move because I had to figure out which nurses could I basically trust, which doctors, what time is the doctor coming in? Because it's only like a good 10 minutes that you get to see the oncologist. So yeah, it's really difficult because they have their own schedule and you have to kind of piece yours in there. How was it for you, Kath? Yeah, how was it for you, Kath?
So when my husband was in the hospital, we had on his chart, and I had in big bold letters on the, I guess it was a whiteboard, that there was to be no discussion with him. They weren't supposed to do anything unless they called me, because he did not want me there all the time. I would have been there all the time. But he didn't want me there all the time. So if I didn't get that call by, whatever time, they do become a little more routine. I think, are you finding that, Milton, that it's between these times, and if they're not in by then, you must have missed them because they came in early?
Yeah. I think they sound, I don't know what it is, whether they have a beeper on me to know to duck me.
Right. So so if I didn't hear, I was on the phone and I would ask the nurse what doctor was in and to page them and tell them I wanted to speak to them. And I must have driven them. I'm sure I did drive them crazy. But my husband would say, if I would ask him, he'd be like, oh yeah, the doctor was in, he said, everything's fine. Well, no, he really didn't. Because, he was supposed to be addressing these 5 things or whatever it was. So if they didn't call, and then I got the hospital to, I want to say they used like a patient advocate. I want to say that was the term the person used, but I got them involved, and they made sure things were happening, and they would go behind as well and get even more information, sometimes more quickly. Yeah, you're doing that, Milton? Yeah, that was fabulous. And then I called our insurance company, because apparently there was supposed to be like this, especially in the hospital, there's supposed to be this health manager, I'm going to call them. I can't remember the exact term. And I had them chasing them down as well. So those doctors started to learn who I was. In terms of the self-care, because I was already part of a running community, and because I had developed those relationships, a little backstory as to why. So my husband and I own a business, and I worked from a home office. I have not worked outside of the home since maybe 2006. Because I think I did work outside the home for a little while. So let's say it was like 2006. I've been working in a home office situation. So I had to find ways to socialize, because it wasn't happening. There wasn't like you walked into work and it was, Bob down there and Mary over there, and you kind of had that camaraderie. I was running a business, and my clients were not my friends, and the people who worked for me were not my friends. So I joined the running community through my son's hockey team, got involved with women. And so I would go out and run, and that included at the hospital. if I was sitting at the hospital, I had my running shoes. We sat in the ER one time for 13 hours, and I would go about every hour, put my running shoes on, and I would do, I would go outside and sort of run a little bit at the Georgetown in DC. It didn't matter what time of the day or night, just to get that 10 minutes. With the music in and just 10 minutes around, just to keep moving, and keep my brain off that. And then when he was home, COVID hit, in March. So from March, we had just come home, March 1st, he had just come home from having been in rehab, trying to get him to be able to at least do some self-care, like get out of bed and walk to the bathroom and back. Get up from his chair and walk to the refrigerator, which would have been like from here to that wall, 5 or 6 steps to grab out his protein drink and carry it back. So all of that being said, so I would schedule and I would go out and run 4, 5, 6. There were sometimes I was running 10 miles just to do that. And COVID made it hard because, you get those looks as you're running by somebody's house because you've got no mask on and you're outside doing something, but I just wasn't going, I didn't care. At that point, I didn't care about my own mortality at all.
Yeah, you just needed a release.
Yeah. And at the hospital waiting, like with the immunotherapy, I took those bands. So you could, you wrapped them up so they would be, this is a tissue, but they'd be like this size. You could put them in your pocket, and I would be doing, resistance bands, sitting there just to keep the physical. And I still don't sleep, Milton. I still struggle to sleep. And I live alone with 2 puppies who would, not that they don't have their own schedule, but, I go to bed at 7:30, 8 o'clock, and I still don't sleep through the night. Just, the anxiety that still hangs in there, the worry, some memory pops in. Actually, it usually is like a really good dream, right? A dream of my husband, some memory at something. And for a while I took things to help sleep. But exercise does help that. I find that the more I do, like tonight I have a lift class, I'll sleep better tonight.
Yeah.
Yeah. All right. I'm going to bring Sally on. She's going to close us out today.
Well, first thing I want to say is we definitely had comments coming through to say that the prayers, of everybody listening are with everybody here, both in the experiences that they've gone through, the inspiration that they're giving, and what they're currently going through. So we want to definitely thank you and all the other caregivers that are definitely out there on the call.